Dr. Evangeline Obi. I'm here to talk about race health disparities. This is African American Month, and I'm speaking on behalf of Ministry Awareness Center and also Mayafa Incorporation, which is a non-profit. Our goal is to educate the population and help them understand what the current health status, health expectations are, and how to better take care of their health. So it is African American Month in February 2024, and I want to talk about how African Americans especially are impacted by disparities in health. African Americans are more likely, the most common cause of death in African Americans are cancer, amongst other things, heart disease especially, and accidents. So it's heart disease, cancer, and accidents. And these are mostly preventable causes. There are cancer screenings that are age dependent. We start screening on time. And also heart disease, most of the time are non-symptomatic. They are injury over time to our blood vessels and our body in general, with the vital organs, the heart being most impacted. And what are some of the things that can impact the heart and the heart function? It could be things that raise the blood pressure, like salt, which things that raise the blood sugar, like diabetes, things that raise cholesterol, like fatty food, and also stress that we can get through our mind, our thinking, relationships, at our job, at home, constant stress with poor sleep, with our family, friends, different things. Social media, things we expose ourselves can impact our health directly or indirectly. So that's why we have to be mindful how we expose ourselves to social media and also expose ourselves to things in our environment. Also things that can impact our heart health, things we put into our body besides food, like substances we use, be it tobacco use, be it alcohol or some street drugs that can cause vasoconstriction and impact our heart health. When those substances get in the body, they may narrow the heart vessels, cause blood flow to be impaired, and cause strain and a gradual decline in heart function. Also, when these things are sustained over time, be it blood pressure, diabetes, cholesterol, or constant stress, when it's sustained over time, may constantly impact the heart and weaken the heart function. Some of it may be repaired, but some may be irreparable, and it continues to decline, leading to heart attacks, heart failure, arrhythmia, which can progress to blood clots that can lead to stroke, or those vessels can be impacted in the brain, leading to ischemic stroke or hemorrhagic stroke, or the kidneys, and cause the kidney to fail. So African Americans, most common cause of death you have to remember are heart disease, cancer, and also accidents. These are all things that can be preventable. So we have to be mindful. And why can people get cancer when they don't get screened and they don't know, or when they don't get checked every year, get their annual physical with their provider and do blood tests? Nobody can tell until they are symptomatic. And 10% of African Americans are uninsured compared to 5.9% of the non-Hispanic whites. So that's a big number that are uninsured. And 12.1% of African Americans that are less than 65 years old have no health insurance coverage whatsoever, which is bad. When you don't have health insurance until you're 65 and maybe get Medicare at that age, things may have been damaged a lot. I had a patient who waited to get Medicare, and by the time she turned 65 and got it, she already had a big colon mass that was colon cancer and died less than 6 months after. So starting on time to take care of your body, be mindful what you put into your body, have the appropriate cancer screenings and health general annual wellness check would help reduce these complications that occur with age. So get insurance is very important. Being mindful what you put into your body, staying active, maintaining a healthy weight would also help. And also knowing your numbers when you have these chronic diseases, that you're managing them well at home. Know what the goal blood pressure would be, the goal blood sugar would be, what your goal body mass index should be, what your goal cholesterol should be, and also eat healthy and be peaceful. Be peaceful with yourself, with people around you, people you come in contact with at work, on the street. All those would help. Make sure you're sleeping well. All those would help. If you're driving, drive with your seatbelt on at a safe speed, and do not be intoxicated as you drive. All those would help reduce untimely death. Mental health, it's shown that 8.7%, study done in 2018 showed that 8.7% of African Americans receive mental health services compared to 18.6% of non-Hispanic white adults, meaning that less African Americans seek help, mental health. And many people are not mentally challenged but have some mental health issues that need to be addressed, either by counseling or by medication or a combination of the two before it escalates. Be it anxiety, be it depression, it's good to start on time before it escalates to psychosis or something that will be harder to manage, or even suicidal or homicidal. Shooting on the streets that is on the increase, and I'm sure most of those, if fully evaluated, could be due to some unresolved mental health issue that was not taken care of, that leads people to smoke, drink excessively, and use drugs, and when they are under the influence can do anything. So mental health is very vital. Make sure you have good family support, good mental health support to help you. Make sure you're sleeping well. Make sure you're taking the right supplements to help your body function. And be mindful of your thoughts. Do not be desiring things you cannot afford. Get good education, good certificates, so you can have a good certificate, good job to be able to get the things you desire without having to take it from somebody by force. And make sure that you live according to your means, your income. And do not be envious of others. Do not be angry or bitter with people. And be prayerful, because when all things are done, sometimes we need more higher power to help us. So that's why prayer and submitting to higher power helps us to get through the day, get through difficult, challenging times, and see better times ahead. Also, chronic diseases, again, I say know your numbers. More than 80% African American women are overweight and obesity, and compared to 64.8% of non-Hispanic white women. So obesity, overweight can be baseline, can be the foundation for most chronic diseases like diabetes, hypertension, cholesterol, even cancer, because it's just excess fat cells that can either be abnormally functioning or trigger some abnormal cells. So we need to be mindful how to maintain our weight, stay fit, because being overweight doesn't mean you're not fit. You can be overweight and fit, but be happy, be fit, be contented, be prayerful, know your numbers, and live a healthy, safe life. Do not hurt your body, and appreciate everyone around you. African Americans and other races alike, we all have a goal for being in this life, not just for ourselves, but also to assist and encourage others along the way, so that at the end of the day, everybody will be happy, everybody will be healthy. Because if one person is healthy and many others are suffering, the goal is not achieved. We should try to be healthy ourselves and reach out and help somebody. That's what makes the difference in the life of saints and good people from the life of ordinary people. Let's not be selfish, but always reach out and help others. Help, because the blessings that come with helping and standing up for others, you cannot even quantify it. It's a big blessing. to always reach out and help. So I encourage everyone to be helpful, to be healthy, especially heart health, and also mental health and physical health. You cannot separate one from the other. All those go together to make a whole healthy person, and maybe a healthy family, a healthy community, a healthy nation. So thank you all. Keep listening to Dr. Evangeline Obi, Ministry Wellness Center, and Mayafa Incorporation. Thank you.